us look forward to Fridays just to get our paychecks. But a frown appears upon our face when we see how much money is being taken away due to taxes. What if I told you that half the tax money taken away from our paychecks goes to welfare programs that help out teen pregnancies? According to Cha-Cha, nearly 750,000 teenage women from the ages of 15 to 19 become pregnant each year. I know, shocking. But we need to get involved and let everyone we know who is practicing, who practice unsafe sex to go on a birth control method. But first, we need to understand why teens have unprotected sex. Next, we need to acknowledge that teens don't have enough money to go on a birth control method. And finally, we need to inform them about clinics that provide them with birth control and useful information. Many people are aware of teens having unprotected sex, but the question still remains, why do they have unprotected sex? Teens having unprotected sex are due to peer pressure and being under the influence. They are being peer pressured by their partners to practice unprotected sex. According to an article by Parents Resource Center, about half the teenage boys and girls told interviewers that they were being pressured by their partners, and it was a big factor in neglecting contraception during sex. Being under the influence of drug and alcohol also affects them not to think about using protection. Parents Resource Center also states that a similar number agreed that alcohol use played a big role in the lack of contraception during sex. Now that we are aware of why teens are having unprotected sex, we need to understand that teens can't provide birth control methods on their own. Most teens don't have enough money to go on a birth control method, nor the age to buy emergency contraceptions, because no jobs are available. According to an article by Engineering News Record, the job rate in August was 16.5%, which was far above the U.S. unemployment level for the month. An emergency contraceptive method like Plan B can't be used by any age without a prescription. Plan B is also known as the morning after pill and can only be purchased at a pharmacy, and you have to be 17 years old. If you are younger, you have to have your parents' consent, and it has to be prescribed by a doctor. And now that we finally know and understand that teens can't provide birth control on their own, we can move on to informing them how to take the right precautions. Here are some birth control methods, some pictures, such as the condoms, the Nuva ring, the birth control pills. On the side, we also have the FemCap and the shot, and also followed by the emergency contraception, which is Plan B. A solution to teen pregnancy is to inform them about clinics such as Planned Parenthood. Planned Parenthood provides birth control and useful information for anyone who desires to have safe sex. It also provides testing services and sexuality counseling. Abstinence should also be promoted. Now that we know why teens are having unprotected sex, and we acknowledge that they can't provide birth control on their own, and informing them on how to take the right precautions, we're all on the right track. If each one of us talked to the teens that are closest to us and informed them about taking precautions and practicing abstinence or safe sex, we can make the teenage pregnancy level drop, which would make a better use of our tax money by putting the money towards school funding for a better education and for a better society. Thank you.